arriving at our patient's home, we will find a suitable place, most likely a flat surface. We're gonna put a plastic. The clean side must be out and the folder apart, touching the table. Then we're gonna to line up with our Manila paper. Clean side must go up, and we will put our bag in our line table. Ask our patient if they have sink and water, and if they don't have, ask for a basin with water. And we're gonna open our bag to get our soap and our hand towel. And we will do a hand washing. Then we will wash our hands with water.
Dahil ko na nag-apply sa ano.
We will wash it with soap. Then we will fix our hand towel and our soap into our bag. Now, for instance, if we're gonna have a funda height measurement, we're gonna take out our measuring tape. So now we're going to close our bag, and we'll put it one side of our working area. So now we are going to close our bag. Then we'll put it on one side of our working area. And now we're going to open our bag again to get our apron. An apron protects us nurses, our uniform, from our bodily fluid that we may encounter throughout the procedure. So we're gonna put this apron. After putting on the apron, we're gonna take out the necessary equipment. Then we're gonna close our bag and put it on side at our working area to prevent cross-examination. Then we will tie the apron. Then to the next procedure. And we will discard all the materials that were used in the proper bin. We will now record our findings and the procedure or care that was done into our notes. We've also asked our patient when we can do our second visit, and we have agreed upon that we will do it again next week. Now we were gonna see the contents of the CHN bag. We have the medicines. We have the ophthalmic solution or ointment. We have also our alcohol, 70% isopropyl, just a small bottle to fit our bag. We also have betadine solution, or just 15 cc to 30 cc or ml. We also have our hydrogen peroxide, just 30 ml. We're gonna assume that this is 30 ml hydrogen peroxide. We also have our spirit of ammonia. This helps a patient who fainted cover. Moving on, we need our sterile gloves, sterile items. We have our disposable syringes and needles. We have first syringes. We need 2 to 3 pieces each of 1 or 3 cc and 5 cc. We also need hypodermic needles, 2 pieces. We also have the gauge 22, 25, 23 and 25. Now for our sterile dressing, we have 2 by 2 pieces of gauge goes. We also have 4 by 4 2 pieces again. We also have 1 pair of sterile gloves. We need 25 pieces of cotton balls in just small container. We also need a cotton applicator, at least 2 pieces, and 2 to 5 pieces of tongue depressor. And we also need a straight catheter, a French 8, just 1 piece. We also need our cord clamp, the disposable one, and KY lubricating jelly, just 1 sachet. And now we will proceed to our instruments. We have the thermometer, we have our scissors, surgical straight, and a bandage scissors. We also have 2 forceps, one that is straight and the other is curved. We have also our baby scale or portable weighing scale with a hook at the bottom. We'll just assume that this is one. We also have the very important, the stethoscope. And we have our stethoscope. And the important one also is the sphygmomanometer. We have the breast pump, the glass one, a pen light that working with batteries. We have our tourniquet that's flat. Of course, the very important, the CHN bag. This is just an assuming bag. And our long black umbrella. And assuming that this is my umbrella, a long black umbrella that we will be using when we are roaming around the community. Moving on to our clean items, we have disposable gloves, 3 pairs. We have rolled gaze, and an elastic bandage, a triangular arm swing, disposable face mask, our micropore tape, and a medicine dropper, a kiddie basin on an apron, a hand towel, our soap dish, assuming that this has a soap case. We have the plastic cover that will line our table and for the bag, and also the manila paper. We have our ice pack and our medicine cup, the plastic one. And that's end our presentation on the demonstration on the things or the equipment we should be having and we should have in our CHN bag. That's all. Thank you.